And then now we want to go to the next question from, I think we're going to the question from Trish in California, which is for Dr. Lirio. When's the best time to test someone for COVID-19?
Oh, all right, my own volume on. Interesting. I get the tough questions here. So if you're referring to the PCR test using the nasopharyngeal sample, we think that the test is most likely to yield a true positive result when it is performed on a patient who has symptoms, usually day 1 to 8. There's a lot of articles out there about this, but if you're referring to the antibody test, you have to have at least those suspicious symptoms for COVID-19 a few weeks. And I will defer to Dr. Buencamino's response earlier to a similar question in terms of timing. We do know if you're going to base it on what we know about immunity, it will take at least, there's several different antibodies that will sort of predict whether you have it right now, you had it a long time ago, and that's subject to, of course, validation, because there are 40 plus tests on antibody tests that are out there. People all rushed to the market when we found out that we needed to test people with antibodies. And so we are really getting to know which test is actually accurate and what's a normal test result, what's elevated. Those things are still going to be validated in the next couple of months.
Well, the next question is also for you, maybe a little simpler on this one. I heard the ibuprofen makes COVID-19 symptoms worse. A lot of people saw this one going around on the internet. Is that true or false?
All right, it's great that you asked this question. This is the purpose of this call, the Zoom call, is to dispel some of those things that are in the public domain. So I really appreciate this question, Eileen. So no, there was a suggestion that ibuprofen might worsen COVID-19 symptoms. At this time, we are not aware of a clear causative relationship between ibuprofen and the severity of COVID-19 or outcomes. So if your question is whether you should start or stop taking ibuprofen, the general consensus is to not make any changes at this time unless you are directed by your primary care physician.
Okay, and what about blood pressure medication? Mila in California asks, I take blood pressure medication and heard that some can affect COVID-19. What do you say, Dr. Lirio?
So earlier there was word out on the public space there that about certain blood pressure medications might, like ACE and ARBs, were thought to increase the severity of a SARS-CoV infection because of, the reason behind that. I will not go into detail of that here, but it's the receptors. But basically, the bottom line is that there is no evidence linking antihypertensive medications like lisinopril or losartan to COVID-19 disease severity, nor does it offer any benefits. So I would not stop nor start blood pressure meds unless it is directed by your primary care provider.
Okay, great. Thank you, doctor. Now let's go to a question about masks. I'll tell you this now, being in the news, who knew that masks would become such a divisive issue? So many people have so many feelings about this. But Dr. Ramirez, should I be wearing a mask when I go out? Mila in California asks. And also, what kind of mask should I wear?
Yes, totally. Good question. So totally, I think the CDC is mandating everyone to wear a mask, and the do-it-yourself masks and cloth masks are perfectly fine because we're reserving the N95 mask and the surgical grade mask for patients, for people who are in healthcare. So those do-it-yourself masks are good.
So can I just add something? I just was so fascinated with the history when I looked at the Spanish flu in 1918. There was actually in San Francisco, you were, how do you call this, mask slackers? You were fined $5 if you walked around without a mask. So, I hope we don't get to that, but it happened in 1918, so it's happening 102 years later.
Let me ask a follow-up question. Anyone can answer this. Do we need masks, say when we need them when we're in the grocery store, we need them if we're going into a business, but what about if you're just out and about taking a walk? What if you're going for a run? It seems like it would be hard to wear a mask to do those things. Do we just need to wear a mask if we're going to come into contact with someone, or should we just have it with us at all times? What do you guys think?
Can I take that? So it's interesting. We still need to listen to our public health officials. So from that standpoint, if your town is mandating you to wear a mask, you wouldn't want to be the mask slacker. But the reality is, you know, if you're running, if you're in your bike and you're not going to be touching stuff, I mean, there's really no reason. But you know, I would defer to our public health officials. If we're mandated to wear it, just wear it. And I know it's hard to be jogging. I jogged this morning and it was really hard wearing my mask. So, yeah. So if you're in grocery stores, if you're close to people, yes, wear a mask.
Yeah,
But if you're going to be, away from people.
I'm just going to add on that, you know, just speaking and you can aerosolize those droplets. And if you pass through that, and it can stay in the air for a while. So if you pass through that aerosolized droplets, you can contract COVID. So that's why mask is very important.
Okay, Ricky in Manila asks, is it true that COVID-19 thrives and lives longer in cooler climate and dies quicker in warm and humid countries? Because everyone wants to know, is COVID-19 going to go away in the summertime? So Dr. Ramirez, what do you say about this one?
Well, in my data, in my slide, I showed what happened to Africa, because they're saying that, you know, in sub-Saharan Africa, because of the temperature, it's not that cold compared to the temperate countries. But now Africa is gaining more cases. So actually the WHO sent out a narrative that said that the climate is not a factor in controlling this virus. So we don't know what's going to happen during the summer. I don't want to bust anyone's summer plans, and I don't know if I don't know if people are having summer plans right now, but you know, we still have to like follow social distancing. That's my key message for everyone.
Yeah, we still need to know what is going to happen, and at this point we don't. Ricky in Manila also asks, can we get COVID-19 from money or coins, Dr. Ramirez?
Yes, because it's another surface, you know, that can live in those surface. So we can totally have contract that COVID from that.
Okay, great. That was our last question. So I know we're a little over time right now, but there were some great answers to questions that a lot of people had. I'd just like to make some closing remarks here on behalf of the Philippine Medical Association of New England. I want to thank everyone for being here. Or those of you who can't see us, who are listening, thank you for listening. And hopefully we can all put into practice what we learned here during this webinar. If you have any questions, anything that wasn't addressed by the doctors just now, you can go ahead and email them at pma.newengland@gmail.com. Again, that's pma.newengland@gmail.com. I'd also like to invite you to the next webinar series that's going to be on May 9th, Frontliners and Survivor Series, a narrative of survival during the COVID-19 pandemic. PMA is asking allied health professionals to send in your pictures. Those will be used to create a video presentation for the next webinar. If you were able to see the video presentation at the beginning, it's going to be similar to that one. And then also on May 23rd, the specialist series, updates on COVID-19 for clinicians. And then on May 30th, PMA New England General Assembly. That one is for members only. We'd also like to thank some of the donors during this pandemic. Dirty Water Distillery in Plymouth, Massachusetts, for hand sanitizer donations. Those were distributed to St. Francis Shelter here in Boston. Also to Mrs. Corinne Corey of Hanover, Massachusetts, for cloth mask donations to be distributed to the homeless in Boston at the Common Cathedral. Once again, thank you. Those, you know, we talked about those masks. They're very important right now. And also to Ms. Masha Senderovich for masksfordoctors.org for the PPE donations. We've talked so much about the PPE at the hospitals and the desperate need for that. So thank you so much. And PMA would also like to thank all the donors who've made this medical and dental missions to the Philippines possible. You see them here on your screen right now, and they are all so truly grateful, PMA is, for your support. For donations, membership applications, renewals, any other inquiries, you can visit the PMA website. That is pmane.wildapricot.org. And again, you can also email any questions that weren't answered today at pma.newengland@gmail.com. So thank you all for joining us. It was my pleasure to be here with you. I also found this webinar very informative for myself as someone who's on the news every day talking about COVID-19. The more information I can learn and I can spread to others out there in the world here in the Boston area, I think we'll all be better for it. And it's all great to learn the information myself. So thank you again for having me, and thank you everyone who tuned in.